Hi, my name is Senelia, and I'm the nurse that's going to be performing a comprehensive exam on Miss Hinckley. So we're going to do a head-to-toe assessment. I have already introduced myself to Miss Hinckley. I've made sure that she is the right patient and she knows why she's here. Miss Hinckley's not complaining of any pain today. I have given her a gown to change into, and I've also provided privacy for her to do that. Miss Hinckley's vital signs were taken by one of our technicians. Her blood pressure is 120 over 80. Her heart rate is 76. Her respirations are 18. And she is 98.7 for temperature and A febrile. So we're going to start our head to toe assessment. The first thing I'm going to do is I'm going to palpate her skull and inspect her skull. And what I'm looking for are any depressions. I'm looking at her hair texture. I'm looking for any lumps or masses, any cuts or lesions, which I do not see. Um, Next, I'm going to look at Miss Hinckley's face, and I'm just going to look at the symmetry to make sure that that's intact, which it is. And now I'm going to look at her pupils. So I'm going to turn the light off. It's going to be on for the purpose of this exam, and I'm going to use my pen light. And what I'm looking at for Miss Hinckley, I need you to look at me. The light's going to be off. And what I'm looking for is her conjunctiva in both of her eyes. And I'm looking for any redness, and there is none. I'm also looking at her sclera, and I'm looking at her pupils. And both of her pupils are even, equal, and reactive to light. Okay. So next, what I'm going to look for, I'm still looking at her eyes. I'm looking for any pallor in her eyelids, which I do not see. She has a good color. I don't see any drainage. I'm looking at her iris and her lenses. And Miss Hinckley has confirmed that she does not wear glasses. Okay. So next, I'm going to use my ophthalmoscope. And what I'm looking at are the margins in her eyes. And they both look normal. Also, what I'm looking for is papillary edema, which I do not see in her eyes as well. So next, I'm going to take my otoscope and I'm going to do an inspection in her ears. If you can turn for me. So I'm looking at her tympanic membrane, and it's pearly gray in color. I don't see any redness or drainage, would indicate a sign of infection. So I'm going to go on the other side and do the same. Also pearly gray in color for her tympanic membrane, no drainage, and no redness in that ear. Have you had any pain in your ears recently?
No.
No. Okay. Perfect. So now I'm going to inspect her nose, and I'm going to use the otoscope for this as well. So I'm going to look at the exterior of her nose. I don't see any deformities. Okay, can you put your head back for me? With the otoscope, I'm looking at the mucous membrane in her nose. I don't see any redness, and I don't see any drainage. Her nasal passages appear clear. So now I'm going to palpate her sinuses above her eyelids, and what I'm looking for is tenderness. Do you feel any pain there?
No.
Okay. And I'm going to palpate here on her lower sinuses. Do you feel any pain?
No.
Okay, so there's no tenderness there as well. Next, I'm going to inspect her mouth. And, okay, great. Open up your mouth for me. I'm looking at the roof of her mouth and the floor of her mouth. It looks pink, and there's moisture. I'm looking for any ulcers or lesions, which I do not see. I'm looking at her oral mucosa, which should be pink in color, and it is. I'm also looking at the floor of the mouth, which is very important because this is where you can see leukoplakia, which are ulcers and signs of cancer. And I do not see any of that. Everything looks great. Okay, thank you. Okay, so we've done that. So what I'm going to do now is inspect her neck. And at first I'm just going to look and make sure that I see symmetry, which I do. Can you turn your head to the left and turn your head to the right? Great, she has great movement there. Everything looks symmetrical. So now I'm going to feel her lymph nodes. And I'm going to start from the back and work my way forward. And then I'm going to start from the back and work my way down. I do not see any signs of enlarged lymph nodes. So I'm going to inspect her trachea, which looks fine. And I'm also going to inspect for an enlarged thyroid, which I do not see, which is perfect. Next, in the head to toe assessment, I'm going to check and inspect Miss Hinckley's skin. So I start at the head once again. I notice her face. She's not diaphoretic. I don't see any moisture. I don't see any dryness. I'm looking for symmetry once again, which I see. I'm looking at her lips for them to be pink in color. If they were blue, it would be a sign of cyanosis, which I do not see. So that looks great. So next what I'm going to do is inspect her arms. And what I'm looking for are any lumps, bumps, lesions, ulcers, any elevations in her skin. I'm looking at her hands. And what I'm predominantly looking for are clubbing of the fingers, which would indicate a cardiac or respiratory issue, which I do not see. I'm also paying attention to her fingertips and looking for pallor, making sure that her fingertips are pink in color and not blue, which would indicate a respiratory or cardiac issue again. I also don't notice any edema in her hands. Perfect. So next, I'm actually going to, for the sake of this, Miss Hinckley is dressed, but if she was in a gown, I would do a head to toe assessment of her skin, and I would look for any nevi, which are moles. I would look for any scarring or any ulcers on her body, which she does not have. So I've inspected her skin. If she did have nevi, I would do the A, B, C, D, E's of skin inspection, which would be to assess for melanomas, which I do not see, which would be asymmetry, a change in color, irregular borders, a diaphragm bigger than 6 millimeters, and any elevations, which I do not see in Miss Hinckley. All right, perfect. So next what I'll do is I'll check her cardiovascular system. So for Miss Hinckley, what I would do is I would ask her to lay down. She would be at a 30-degree angle. I'll have you lay right there. Once you change the patient's position, you always want to assess for comfort, just to make sure that they're comfortable during any procedure, any assessment, and that way they're able to give you appropriate feedback about their condition. Okay, so for Miss Hinckley, I would measure the jugular venous pressure, and I would do that from her neck to her sternum, and I would note that. Next, what I would do is I would take 2 fingers and I would palpate her bilateral carotid arteries, and I would start with the left, and then I would do the right. I feel a regular rhythm with no bounding. On visual inspection, I do not see her carotid arteries bounding as well. So next, I would auscultate Miss Hinckley's carotid arteries for any signs of bruit. No signs of bruit. Next, I would listen to Miss Hinckley's heart sounds, and I would use the diaphragm of my stethoscope. And then I would turn to use my diaphragm to listen to the apex. Excuse me, I would turn my stethoscope to the bell to listen to the apex. S1 and S2 sound normal. S1 should sound louder than S2 at the apex, which it does. I don't hear any abnormal heart sounds or any murmurs with Miss Hinckley. Okay, you can stand up. You can sit up for me. Perfect. Okay, next I will examine her respiratory system. First, I'm going to do the anterior respiratory system. And for this part of the examination, I will ask Miss Hinckley to lie down again at a 30-degree angle. So first, I'm going to inspect her chest. I see symmetry. I don't see any deformities. I don't see any rapid breath movements as if she's gasping for air, which is a good sign. I will palpate the chest wall, looking for tenderness, which I do not see. I will percuss all areas of the chest wall. Looking for abnormal sounds, which I do not. Everything sounds normal. And now I will listen for breath sounds. And what I will be looking for are any wheezes, any bronchi, any diminished breath sounds, or anything unusual. Just breathe normally for me. No adventitious or abnormal breath sounds heard. Okay, so now I'm going to assess her respiratory system posterior, so I will need Miss Hinckley to sit up for me. So for the posterior, I'm going to inspect her posterior, if you can just turn for me here. Posterior, I'm looking for asymmetry once again, which I do not see. I'm going to palpate for any soreness or tenderness. Any pain there?
No.
Okay, so there's no tenderness there. I'm going to percuss. And all the lungs are resonant for this exam. Okay. So now I'm going to inspect for respiratory exertion. And what I'm going to do is put my hands on her back in this manner. And I'm just going to ask her to take deep breaths, inhaling and exhaling. Take a deep breath. And one more time. And I'm looking for symmetry, making sure that both sides expand equally. Okay, you can sit back as normal. Finally, I'm going to listen to breath sounds on the posterior side for adventitious sounds. Turn around for me one more time. No adventitious sounds all the way down to the lower bases. Great. So now I'm going to do a neurological exam, and I'm going to test Miss Hinckley's orientation. Can you tell me what your last name is?
Hinckley?
Can you tell me what today is?
Sunday?
Great. Can you tell me what you would do if you found a stamped envelope on the ground near a mailbox?
I'd pick it up and put it in the mailbox.
Great. So I just tested Miss Hinckley for her orientation and her cognitive ability. Now I'm going to test Ms. Hinckley's 12 cranial nerves. The first cranial nerve is the olfactory nerve, which we tend not to test unless there is a neurological issue, which there is not here. Number 2 is the optical assessment for cranial nerve number 2, and what we would use is the commonly used Snellen eye chart, which we have, and Ms. Hinckley has 20/20 vision. Next, we're going to test cranial nerve 3, 4, and 6, which controls the ocular movements. So what I'm going to do is ask her to follow my finger. Okay, so you're going to look straight ahead, right at my finger, and then you're just going to follow the movement that my finger has. Perfect. Great. Now we're going to test the 5th cranial nerve, and that's the motor and sensory response. So I'm going to ask Ms. Hinckley to clench her jaw. That's great. And you can also see how the mandibular jaw is doing as well. And now I'm going to perform the sharp and dull test with Ms. Hinckley. So you just tell me if it feels sharp or dull, okay?
Okay. Dull. Sharp.
Great.
Dull. Sharp.
Great.
Dull. Sharp.
Perfect. Now we're going to test cranial nerve number 7, which are facial expressions. So I'm going to ask Ms. Hinckley to follow a few directions for me. Can you raise your eyebrows? Great. Can you close your eyes? Perfect. Can you puff your cheeks? Great. Can you show me your teeth? Perfect. Okay, now we're going to test cranial nerve number 8, which has to do with hearing. I'm going to whisper something into Ms. Hinckley's ear on both sides and ask her to repeat what I've said. Say it. You can say.
21. 14.
Great. Okay, so cranial nerve number 9 and 10. I'm listening to Ms. Hinckley's voice during this exam, which I'm looking for hoarseness, which I do not hear, which is great. And then I'm also going to test her gag reflex. Now, can you open up your mouth for me and say, ah? I'm placing the tongue depressor in, and then there's a gag reflex. Perfect. Cranial nerve number 11, I'm going to test her back and her back muscles. So I'm just going to ask you to turn this way for me. And all I'm going to do is ask Ms. Hinckley to shrug her shoulders against force, upward. Perfect. Okay, I'm going to ask her to turn back around and face me. Now I'm going to ask you to turn your head against my hand. That way. Great. And turn your head against my hand that way. Perfect. So I'm looking for strength, which she has, which is great. And that's good for that. And number 12, we're going to look at her tongue, which is cranial nerve 12, and just ask her to stick her tongue out at me. I'm looking for any deviation, which I do not see, which is perfect. Lastly, we're going to check Ms. Hinckley's muscular assessment. So first we're going to do the upper extremities. So I'm going to inspect and palpate Ms. Hinckley's upper joints. Make sure that she has good range of motion. Just looking at all of her digits, making sure she can bend all of her extremities. Okay, everything looks great there. Now I'm going to test her strength and ask her to squeeze my fingers as hard as she can with both of her hands. As hard as you can. Perfect. Good upper strength on her hands, which is great. Now I'm going to do the point-to-point movement test, where I ask Ms. Hinckley to point at my finger and then point back at her nose. Can you touch my finger with your finger and touch your nose? Touch my finger, touch your nose. Touch my finger, touch your nose. Perfect. That test is to look for hand-eye coordination, which she did great. Now we're going to do lower strength. So I'm going to look for active and full resistance from Miss Hinckley. So I'm just going to ask her to raise her knee against my hand. I'm going to press down, which she did great. We'll do the other leg, press down, great. We're going to do the same with your lower extremity on your foot, press backward, good strength. The other foot, good strength. Now we're going to ask you to press down onto my hand with resistance, good strength. Press down on this hand with resistance, good strength. That's perfect. I am going to observe Ms. Hinckley ambulate to assess her gait. So I'm just going to ask you to stand up and walk to the window and walk back and have a seat. Perfect. So Ms. Hinckley's gait was assessed and she's steady on her feet while ambulating with no issues. So this was a complete head-to-toe assessment for Ms. Hinckley. She checked out fine. It looks like from head to toe, she's doing great and healthy and in great condition with no further issues. And I'll write up my recommendation and submit that soon. Thank you so much.
You completed touchscreen?
No.